Thank you, Judith. Thank you for inviting me to speak today. And in that connection with, as chair of the National Development Team for Inclusion, or NDTI, as we try to call it for short, very pleased to add another connection to your map today, because we work with Outside the Box up here in Scotland. Very pleased to do that. Thankless task following Cormac, as you'll appreciate. But I'm coming at this from a slightly different perspective, and that is as a long-time observer of the social care scene. And I guess the one thing in all that Cormac said that I would take slight issue with was his point that we can either have more hospital beds or more hospitable communities. Actually, we can't have more hospital beds. And that's really the premise for my remarks today. We have hit the wall in terms of public funding, and we're looking at another 4-5 years at least of austerity. So we have to make this stuff that we're talking about today work. Theme is bridging the care gap, how galvanizing communities can support our population. And here's a gap, in case you don't know what it is. Here's a bridge that doesn't meet in the middle. I guess some young people might think immediately of a high street clothing chain, but this is what we're about. And here are some of the harsh facts. Almost 3 million people with long-term conditions by 2018. About 1.5 million people with dementia by 2030. Already older people accounting for 60% of hospital admissions, 65% of all the bed days in hospital, and about 56% of social care spending. And as well as that, and if you talk to some social services directors, social care directors, they'll say it's not actually the aging population that worries them, it's this other thing, it's learning disability. We've got sharp rising numbers of people with learning disability, anything between 3 and 8% a year, we don't know. Our grip on the data is so poor, we haven't got a clue. So that's the challenge, and this is the supposed response. And these are figures for England. I'm sorry about that. These are taken from Skills for Care, which is the skills care agency for social care in England. Already you've got 1.8 million, 1.9 million jobs, growing at a rate of 4.5% a year. Projected number of jobs by 2025, 3 million, 3.1 million. It isn't going to happen. There is not the money in the system. And already in Scotland, you've had 3 years of slightly falling numbers of people working in social care. I think the figure's about 190,000. It's come down in the last 3 years. I think you may already have hit maximum numbers on that, and we heard earlier about the problems of recruiting up here in Aberdeen. Why do you have falling numbers? It could be financial constraints, could be the age profile of the workforce, a lot of people retiring, or it could be just be poor counting. We could be more people working as PAs than we know about. Again, we've got a very shaky grasp on the data of much of this kind of stuff. And I think it's important to say in this context that. And it's a bit of a health warning, I suppose, that yes, of course, we should celebrate the aging of the population. It's a great thing. I always say when I give talks that you might not like much of what I say in half an hour, but you'll get 6 or 7 minutes back, because that's how much we're gaining in life expectancy every day. 5 hours every day. It's absolutely extraordinary. Can this go on? Perhaps with current diet and drinking habits, maybe not, but that's been the pattern for the last few years, certainly of the baby boomer generation. So I say there's no money, the money's run out, and you'll probably be familiar with the graph of doom. This was first done by the Barnet Council in North London, actually it's where I live, but other people have copied it since. and it shows that by about 2022, on current projections, there'll be no money left for anything in local government except adult social care and statutory children's services, nothing else. Obviously, it's a slightly overstated argument for, demonstrative purposes, but actually there's a very important point in there, and I think it's highly unlikely that by the end of the next Parliament, 2020, there'll be many, if any, public libraries in England run by councils, many leisure services run by councils, but already seeing local government withdrawing from areas of service provision that we've become accustomed to since the war. But this isn't just something that I think has come on us in the last 5 or 6 years in austerity. I've actually been talking about this for a long time. This is a paper I wrote for the Roundtree Foundation back in 2008, saying that actually the community has to step up to the plate to help with this challenge. And you're thinking, oh, well, he's talking about big society. A discredited term, of course. It's not worked out very well at all. You won't hear many politicians uttering these words between now and May the 7th, the general election. Why did it fail? Timing, obviously not a great idea to be talking about this at the same time as implementing the most ruthless set of public spending cuts we've ever known. And I think a lot of resentment because a lot of groups who were already doing things that would be called big society felt rather grudging about David Cameron suddenly inventing this concept. This is something that's actually not been published yet. So I'm sharing it with you in strict confidence. It's from the Community Development Foundation, a piece of work they're about to come out with. And they've mapped how many community groups there are. And they've found there are 1 million community groups delivering services in and around building safer communities, improving the physical environment, enhancing health and well-being, and supporting local economies. And this is how they're going to be representing the benefit of these communities, almost all of which have annual income of less than £2,000 a year. Really micro, hyper-local groups delivering astonishing returns already on the ground. I think it's a lot of these groups that sort of felt that they were being reinvented by the big society rhetoric. Are we undermining the welfare state in talking about this, which is the challenge which is often made, the 1948 settlement? Well, actually, if you go back to what Beveridge said, I don't think we are. He said the state should not stifle incentive, opportunity, responsibility. In establishing a national minimum, it should leave room and encouragement for voluntary action by each individual to provide more than the minimum for himself and his family. And up here in Scotland, I thought I'd introduce one of your patron saints, Jimmy Reid, in his legendary 1972 address when he was installed as rector at Glasgow University. He talked about the resources of our people as being immeasurably more than the then untapped resources of the North Sea. And I'm convinced the great mass of our people go through life without even a glimmer of what they could have contributed to their fellow human beings. So there's a rich heritage of this, and I don't think it is in any way trying to subvert the 1948 welfare state settlement. Well, politicians, of course, have picked up on this, and from Jimmy Reid to Norman Lamb, a bit of a leap. Norman Lamb is the English Care Services Minister, and he's been talking a lot lately about trying to inspire community action. He's called it a neighbourhood watch for care to guard against isolation among older and disabled people, and he's likened it to Neighbourhood Watch for community safety. And it's this loneliness issue is really becoming quite a big political issue. I don't know about perhaps up here in Scotland, but certainly in England. And people are now starting to read across into all kinds of sectors how important the loneliness factor is. This was a study that came out just a couple of weeks ago about, which I think you may have heard on the national TV and radio, about the numbers of lonely old men. And they came up with, by 2030, 1.5 million older men will be suffering the mental and physical consequences of chronic loneliness. So the key question, one of the key questions is, are people up for playing a bigger role, responding to this challenge? And this is some work that, some recent work by Ipsos Mori, when they asked the usual sample, 1,000 people or so, whether they agreed with these statements. Should people get more involved in helping improve our public services? Strongly agree 49%, tending to agree 37%. I should get more involved, a bit less, but actually still quite a strong response. Paradoxically, people still think the government should have a continued responsibility. Do people think they have skills? And this goes back to Cormac's opening challenge to us this morning when we got us talking about that. Do I have skills that my neighbours might find useful? And actually, 63% either strongly or tend to agree with that. They think they have got skills they could contribute. Then you get down to the nitty-gritty. To what extent would you be interested in doing these kinds of things? And this is quite interesting because people, 6 in 10 people say they'd be happy to do some shopping for an older neighbour, and 53% say they'd be prepared to do it once a week. Bit of cleaning up with a group of volunteers in the neighbourhood. 58% would be up for that, and 44% would be up for organising that kind of activity. But when it comes down to the bottom, visiting patients in a local hospital, actually rather fewer would be prepared to do that. Only 1 in 3 people say they would, and of course there's a big difference between saying you would and actually doing it, as we know. But that maybe raises an interesting question about whether people are prepared to do things which they would see as being replacing services, or doing something for a neighbour which they wouldn't see as replacing services, but supplementing what services do offer. Volunteering, of course, has been pretty much flatlining since the turn of the century, and these figures show that. So there is, I think, some potential to build. And a lot of people say, well, you'll never get, this is a generational thing, you'll never get young people to do this. It's all about old ladies, making tea for the National Trust. But actually, the data shows otherwise. It shows that there is a very strong willingness and indeed involvement of young people in volunteering. 42% informally there in the age group 16 to 25, 31% formally. So it's a bit of a myth that young people can't be attracted to do this work, or work quotes. What is happening on the ground then at the moment? What are people, or regular uncredentialed folk, as Cormac called them? What are they doing in association to build community strength? Three quick examples. This is the Casserole Club. This is something that's starting to work around London and Staffordshire, and in fact has just launched in Australia. They gave us men's sheds, we're giving them Casserole Club. The idea is that you volunteer to make an extra portion of dinner, for a neighbor or somebody close by who wants it. You go through all the usual checks and it's all okay. The problem at the moment is they've got more people volunteering to do this than people who want to eat the food. For whatever reason. But it is actually starting to develop some momentum in the areas it's working in. This excites quite a lot of people. Second example, from Buckinghamshire. This is a scheme called Prevention Matters. It's a £4 million 3-year scheme. The aim is they've got a firm target. They say that over 3 years, they're going to reduce by 25% the numbers of people depending on health and social care around Buckinghamshire. And they've relied on, or they're introducing roles rather like Cormac's community builders. These are paid roles, 14 community officers, 7 community link officers working on their generating volunteer activity. In the first 6 months of 2014, this year, more than half of the volunteers they attracted had never done any kind of volunteering before, and they've helped 1,300 people, worked with 1,300 people in the last 12 months. One of the key points about this project is that they give the volunteers credits, time credits, which they can trade in to attend training, leisure services, even film and theatre. So people get a payback. And this incentive idea is, I think, quite important. And it's developed further in the one I'm just about to show you. But this is an individual incentive scheme getting off the ground in Buckinghamshire. This is the one I'm closely involved with, and I'm an advisor to this project. This is developing and empowering resources in communities, Derrick. And it works currently in Belfast, in Sandwell, in Medway, and is getting off the ground, and in Leeds, and is getting off the ground in Bristol and Havering. So 5 or 6 sites, and it's got about £1 million of big society capital funding to invest. This is an article from The Guardian recently about the scheme in Belfast, which is probably the most advanced of the projects and where we've actually already invested some of that big society capital money in the last few months. The program is called, within Derrick, is called Combining Personalisation and Community Empowerment, a bit of a mouthful, CPCE. And the theory is that we can make savings of potentially £400,000 per project on the assumption that 1 in 5 of the people we work with, or the schemes work with, because Derrick is just an umbrella organisation, will reduce their use of services by half. And this is the key. The savings, net of costs, in each area, each CPCE, come to, hypothetically, £222,000 in each area. Those are shared equally between the local authority and hopefully in the future the NHS. They get half back from the savings of people not requiring statutory services. The other half is retained by the community group to invest in community development. So actually quite substantial potential incentive for community groups in Belfast, in Leeds, where they're already working, to make this work, because they get quite a big payback. And I think this incentive idea is something is something quite important and something you may wish to talk about in the course of today. So the plan is that we'll reach 20% of all people eligible for care services in 20% of councils. So 1 in 5 people in 1 in 5 councils. We're looking at a £3 million investment. We've got £1 million already. There's some more money hopefully coming on stream. We hope that 1 in 5 people, as I say, will reduce their use of services by half. And potentially, there's that kind of saving to the public purse, and there's that kind of saving, that kind of money going back into communities in a social dividend. That's the plan. Being properly evaluated by Leeds and universities in Leeds and Huddersfield, so there'll be a monitoring of this as we go forward. Report just out today, in fact, from London Economics, a consultancy, talking about the potential of social investment in this area. So calling for more funding of the kind that we've procured from Big Society Capital. That £1 million we already have, hopefully some more. This consultancy report today, which is for Age UK and indeed for Big Society Capital, saying that if the government was to set up a pool, a funding pool, the potential for this could be very considerable indeed. It's not all good news. The Circle movement, a lot of excitement around this a couple of years ago. This was starting to operate across London and in other parts of the country. David Cameron in 2009 said it was delivering vastly improved care services for less money, designed by elderly people, for elderly people. Essentially, it was a local social network movement. Older people had to pay a subscription, though, to join it, and it had a lot of public money pumped into it. And if you go to the Society, the London Circle's website now, this is what you find. A statement saying, we're very proud that we've shown it can work. Sadly, however, in the current climate, etc., difficult to continue. Sad decision to cease trading from the end of March. So it's closed down in London. It's also closed down in Suffolk. It is still functioning in Nottingham and Rochdale, where critically, where the local authorities have made long-term funding commitments to support the circles there. But it's a harsh lesson, I think, that this is not by any means all plain sailing. On the positive side, the research base is growing to show the value of this kind of asset-based community development. This is a report in the November academic journal Health and Place, looking at, which has analysed admissions to care homes and use of statutory care services in Northern Ireland, actually carried out by Glasgow University. And after making all the usual adjustments, it's found that people in rural areas are 25% less likely to access statutory services because, it concludes, they have stronger both family but also critically community links. And that helps them stay independent. And we're short of this kind of evidence base, but it is starting to come through. And of course, in terms of convincing government to put money behind, to pump prime these sorts of schemes, this sort of evidence is absolutely critical. And indeed, a lot of the big thinkers in this area are now really getting quite enthusiastic about all of this and about this potential. This is Matthew Taylor from the RSA, and he's coined this term beyond policy, which he's called a new paradigm for social change. And he's saying that the key criterion now for public services is social productivity, is this idea of getting people to better contribute to meeting their own needs and those of their community. And he's called them beyonders. Rather clumsy phrase, but people who believe in this beyond policy concept. Beyonders, he says, put greater emphasis on citizens not only engaging with decisions, but being part of their implementation. Likely to see civic mobilization as preceding and possibly being an alternative to legislative policy. So he's saying the future is all about bottom-up, and it's decreasingly about top-down. And he's speaking, I think, from a lot of the pointy heads around the social policy landscape. So there we are. Civic mobilization, I think, is the way forward. It's the antidote to what Cormac has called in the past the death rattle of the welfare state, and there is definitely a death rattle out there if you listen carefully. It's the asset community. It's the way, in my judgment, we're going to get through all of this. So thank you very much.